Today I'm going to teach you about comfort positioning for invasive procedures and how you as parents can help your child cope. Oftentimes when a child is having an invasive procedure done, the best and most positive coping strategy is comfort positioning and just being held by a parent. Comfort positions are positions which promote comfort for a child during an invasive procedure by incorporating comfort holds with the child. Comfort positions provide support for both the child and the parent, offering close contact and facilitate the procedure by making it less threatening. In a nutshell, comfort positioning promotes upright positioning in a positive way rather than forceful restraint in a negative way. Comfort position model has 5 parts. The first is inviting parents to be present, which this video is doing. The second is to prepare child and parent for the procedure and their roles during the procedure. The third is to utilize treatment rooms in stressful procedures to make things less threatening and when this is available. The fourth is to position a child in a comforting manner. And the fifth is to maintain a calm, positive atmosphere. Some of the goals of comfort positioning are providing a secure hold for the procedure, providing close physical contact with a parent, participation of the parent in a positive assistance and not a negative restraint, incorporating sitting positions, promoting a sense of control rather than anything forceful for the child and the parent. And fewer people are then needed when comfort positioning is used. And oftentimes what is most stressful to a child is just the number of people in the room, and comfort positioning reduces that number. There are many different types of comfort positioning. The first is one person IV holds. One of the parents holds the child on their lap. Their arm is placed around the child's back, grasping the child's upper arm on the other side, and the parent's other hand is free to hold the child's hand should they desire. For this position, it is important to hug the child to the body in order to offer a secure hold. A 2-person hold for IV placement is when the child is sitting on the parent's lap, chest to chest, and the parent has the child's legs hanging off of each side. This allows the parent to provide a nurturing hug. And what is also helpful about this position is that the child's legs can only kick from below the knee, and their arms are secured by the parent's embrace. The child can easily watch or look and focus on distraction items should they choose to, because their head is free. A team approach for an IV is when the child is held by the parent. For the position, the arm is held by the nurse, usually with a folded sheet or a soft pillow, in order to allow for more comfort and less confinement. A position to watch for an IV, the position allows for more room for the staff to work and is helpful for the children with respiratory conditions because it's not as confining. This setup is for positions the arm securely on a treatment table, so there's less room for it to move around, and the parent hugs the child on their lap. IV placement in the foot is when the comfort position is sitting position on a bed, which decreases the ability to kick or move the child's leg because the bed is flat underneath it. Parents should be close and able to comfort their child from behind or on the side. Sometimes we think that a hold on a lap is best for the child and allows for the easiest access, but when placing an IV in the foot, sitting on the bed allows for the nurse to use the bed as a secure spot. Parents can hold or hug their child from behind and comfort and safe security of the upper body. Injections in the leg are similar. The child sits sideways on the parent's lap or on the bed while the parent hugs the child into an embrace. This allows for the parent to keep the child still in a positive way, but also allows the nurse to access the leg for the injection. Side sitting position is used when a child cannot straddle their parent. This allows for the mobility and kicking and moving rather than chest to chest position for an older child because they feel secure and less confined. Some of the benefits of comfort positioning are that they help children feel more control and potentially stressful situations and procedures. They also allow parents to have an active part in their child's care by providing comforting touch. Comfort positions lessen the use of sedation medication, which is always positive, and they allow children to feel secure in their parents' arms, which is oftentimes the safest place for a child. Comfort positions provide a positive procedural experience so children may not feel fearful for future procedures down the road. And comfort positions allow children to experience a procedure without feeling restrained so that they can more fully engage in diversion and self-calming techniques. It is clear that there are different reasons, uses, and benefits to each of the comfort positions. There are other aspects that can be utilized in comfort positioning, such as one voice, maintaining calm environments, and distraction techniques. One voice is a series of techniques utilized together to support the child experiencing an invasive procedure. One voice is when the amount of people talking is limited to only those necessary, preferably one. And this reduces the amount of stimulation in the room during an invasive procedure. Maintaining a calm, positive atmosphere is helpful to enhance comfort positioning, and this can be done by softening the lights in the room, removing unnecessary people and supplies, and promoting positivity throughout the procedure. Some developmentally appropriate distraction techniques that can be used are bubbles or light-up toys for infants, toddlers, and preschoolers, different books, music, and stress balls for school age or adolescents, and iPads depending on the game for any age. Other things to remember is that it is developmentally appropriate to cry. It is okay for your child to cry, and it is okay for you to cry during an invasive procedure. Comfort positioning may not always work, but it is always good to try it, and it can only help for the positive in most situations.